Welcome to my channel. Please subscribe my channel and press the bell icon now. Breast anatomy and physiology. Each breast has 15 to 20 sections, called lobes. They are arranged like the petals of a daisy. The breasts comprise glandular, connective and fatty tissue. Each lobe has many smaller structures called lobules. These end in dozens of tiny bulbs that can produce milk. The lobes, lobules, and bulbs are all linked by thin tubes called ducts. These ducts lead to the nipple in the center of a dark area of skin called the areola. Illustration of the anatomy of the female breast. Front view illustration of the anatomy of the female breast. Side view. Fat fills the spaces between lobules and ducts. There are no muscles in the breast, but muscles lie under each breast and cover the ribs. Each breast also contains blood vessels and vessels that carry lymph. The lymph vessels lead to small bean-shaped organs called lymph nodes. These lymph nodes are found in clusters under the arm, above the collarbone, and in the chest. They are also in many other parts of the body. Anatomy of the breast. Chest wall, pectoralis muscles, lobules, nipple surface, areola, lactiferous duct, fatty tissue, skin. Chest wall, also known as thoracic wall, is the boundary of and serves as protection on internal organs inside the thoracic cavity. Pectoralis muscles, any of the muscles that connect the front walls of the chest with the bones of the upper arm and shoulder. Lobules, a group of alveoli, the milk-secreting cells in the breast. Nipple, a small projection of skin containing the outlets for 15-20 lactiferous ducts ranged cylindrically around the tip. Areola, the pigmented area on the human breast around the nipple. Lactiferous duct, the structures which carry milk toward the nipple in a lactating female. Fatty tissue helps provide shape and support for the breast. Skin, the superficial layer that provides shape to the breast, which come in contact with the baby when breastfeeding. Stand before a mirror. Inspect both breasts for anything unusual, such as any discharge from the nipples, puckering, dimpling, or scaling of the skin. Do-it-yourself monthly breast self-exam. 1. The next 2 steps are designed to emphasize any change in the shape or contour of your breasts. You should be able to feel your chest muscles tighten while doing these steps. 2. Watching closely in the mirror. Clasp hands behind your head and press hands forward. 3. Next, press hands firmly on hips and bow slightly toward your mirror as you pull your shoulders and elbows forward. Some women do steps 4 and 5 in the shower. Fingers glide over soapy skin, making it easy to concentrate on the texture underneath. 4. Raise your left arm. Use 3 or 4 fingers of your right hand to explore your left breast firmly, carefully, and thoroughly. Beginning at the outer edge, press the bat part of your fingers in small circles, moving the circles slowly around the breast. Gradually work toward the nipple. Be sure to cover the entire breast. Pay special attention to the area between the breast and the armpit, including the armpit itself. Feel for any unusual lump or mass under the skin. Repeat the exam on your right breast. 5. Gently squeeze each nipple and look for a discharge. 6. Steps 4 and 5 should be repeated lying down. Lie flat on your back, right arm over your head and a pillow or folded towel under your left shoulder. This position flat tends the breast and makes it easier to examine. Use the same circular motion described earlier. Repeat on your right breast.